My takeaway is really that the stocks are at the highs of the day, so the market itself is not really
Why?
more
What was
concerned.
the concern? What was the?
I think the concern was that there was actually going to be real regulatory reform, and although not surprisingly, the administration is moving towards a market-based approach, which without regulations probably not going to put too much pressure on prices, at least in the near term.
Is the market's take, and is your take, therefore, that this is all talk and no action? Once again, is that why we saw them sell off initially and then rally?
Yeah, I think it's not a coincidence that at 202, all the stocks took off. And so at least that's the market's interpretation. Obviously, it's a long-term time horizon for this, so we'll see.
I wonder if that's part of it. You know, some of the changes they're talking about are going to take a long time to be implemented and work their way through the system and then to figure out what that looks like. But if you take them at their word that they're going to call into question the entire structure of drug rebates, the pressure on those participants in the system becomes greater. Would you steer clear of the likes of Express Scripts?
It's in my view that it's inevitable that things like rebates and price gouging are going to go away. It's just at what point in time. So yeah, I would stay away from them. There's going to be a lot of volatility. We do have a midterm election coming. There's going to be even more volatility. But we prefer idiosyncratic companies that are going to do well. Companies like Penumbra, that's creating things for stroke, Phoenix, which is lowering prices on their drugs by distribution chain. So all sorts of interesting companies, Maser Robotics, you name it. If you're improving quality, you're going to do well as far as the stock. There are obviously companies like United Health, Boston Scientific, and Health Equity that do well, you know, in a rising environment, and we also think those are going to be do well. We are short some of the biotechs and some of the large pharma because they've got nothing going on. It has nothing to do necessarily with macro factors.
Just in terms of the speeches and the announcements we've heard this afternoon, has that changed your conviction in any of the names that you do hold in terms of more or less positive on them?
No, I mean, it's just one more hurdle we left that I don't have to deal with. We still have to deal with all the fundamental issues. Now, to give them credit, these folks have some technical expertise in the industry that maybe prior administrations haven't. So at least they seem to know, if you pardon the metaphor, bodies are buried. So at least they've identified the problems. But I have a funny feeling this is a thing that may happen in the mid-2020 timeframe where prices have gotten just so high that people just throw up their hands.
You mentioned like United Health because there's this rising environment, but all the rhetoric we just heard is about how they want to make sure that instead of the system incentivizing higher prices, now it doesn't. Does that mean, is that what you're referring to there? That if that pricing pressure goes the other way on healthcare, would United Health hurt, or you don't think that's an outcome here?
Well, unfortunately, I'm sorry to say, we'll give you a wishy-washy answer. It depends. I would say they're talking about just strictly using incentives, and in my judgment, incentives aren't enough, market incentives, because we basically have had a market failure, and so we're using market-based incentives to try to think that market-based incentives has already failed. Now, a strictly regulatory regime won't work either because there are all these loopholes that he alluded to in Part B. So we need a combination of both, and unfortunately, the two political parties seem so polarized and philosophically apart that you'll find no middle ground. So until they can get it together, you know, we're going to be beneficiaries of demographics. Yeah, we're all lost.